Now again we are discussing about the new another topic, that is nose irrigation. Nose irrigation. Now definition: occasionally nasal irrigation are ordered to clean the nose, to apply heat, to relieve congestion, swelling, and pain. Congestion, that means the feeling of stiffness in the nasal, or it is the feeling of fullness in the sinuses. Those medications are administered to relieve the feeling of fullness in the sinuses, to remove those mucus from the nasal. They are also called as nasal lavage, which are used to flush out the mucus from the nose and sinuses. Now, purpose. First, it is used to give relief to the patient with chronic atrophic rhinitis or prior to the local application of an oestrogenic compounds. Chronic atrophic, that means it is the chronic inflammation of nose by the accumulation of the nasal mucosa. Uh, it is used to prior the local application of an oestrogenic compound. Thirdly, however, the nasal irrigation are not commonly ordered because of the potential danger of forcing infected matter into the patient's trachea tubes or sinuses, or both. Aspiration of fluid into the lungs also is a potential hazard. Now, general instruction. Firstly, no, as far as possible, natural irrigation are avoided with potential hazard of forcing infected materials to the adjacent cavities. Nowadays, improper use of food and drug administration and other devices for rinsing out the sinuses, which is very harmful for the human beings. They are misusing the food and drug administration for the nose, medication, as the nose medication. Secondly, nasal irrigation are given only in the written order of the doctor. Nasal medication are only administered on the behalf of physician orders only. The solution used for the nasal irrigation are normal saline or any mild antiseptic ordered by the doctor. Those medication which are used to prevent the bacterial growth on the nasal area or nose, those solution are used for the nasal irrigation. It should not be harmful for the patient if it is swallowed accidentally. It should be sure that if the patient swallowed the medication during administering any medication, it should not harm for the patient. Since the patient may feel hard to speak of or swallow, it is desirable to teach him how to hold the tip of the nozzle, how to remove it, and how to control the flow of fluid. If properly tied, the patient can take the irrigation himself. Patients should be taught how to hold the nozzle, how to remove it, or how to tie the nozzle. If it is taught properly, he or she can take the irrigation by him or herself. Most patient may feel hard to speak or cough while administering the medication. Patient may feel hard to speak or cough. So if it is explained to the patient, it will be easy while administering the medication. Now, we are talking about the procedure should be taken before administering the during administering the medication. Firstly, nurse should be responsible about explaining the procedure to the patient to win his confidence and cooperation. It is the very important things that nurse should not forget to do. The patient must be asked to breathe through the mouth and to cough, speak, or swallow. Patient is not allowed to breathe through the nose because it is difficult to administering to the nose. Otherwise, all the medication will thrown out while breathing by the nose. For a while, patients will be allowed to breathe through the mouth only and to cough, speak, or swallow. Um, Now, place the patient in a sitting position on a chair or in a bed with the head bending forward. Patient should be placed in a sitting position on a chair with the head bending forward. It will helpful for administering the medication. Use an irrigation can with the tubing keeping it 12 inches above the nose. Irrigation can should be keep above the 12 inches, which can help during the administering the medication. Maintain a steady and continuous stream of solution into the one of the nostril and allow the fluid to run out of the other nostril. When the desired effect is achieved, stop the procedure, try and nasal passage and make the patient comfortable. Firstly, medication should be allow for a one of the nostril and allow the fluid to run out to the another nostril. If any effect is achieved, suddenly procedure should be stopped and dry the nasal passage. Now we are discussing about the nasal instillation. Definition: a nasal instillation is a medicine or a solution prepared for administration into the nose. Nasal medicine is given in the form of nose drops or sprays. As we know that nose is not a sterile, but it must be absorbed because it is connected to the sinus. Now we will talk about the purpose. To combat the infection, it will help to provide the astringent effect. That means astringent, it helps to provide the astringent effect. That means it helps to provide the contraction for the mucous membrane or contraction for the exposed tissue, which helps to reduce the discharge of the mucus secretion. It helps to relieve the inflammation and congestion in case of rhinitis. It helps to give the local anesthesia. Now we are going to talk about the general medication. Firstly, medication are instilled only on written order from the doctor. Medication are only ordered after the physician order. Avoid well-based solution as nasal drops, since it interfere with the nasal ciliary action and may cause aspiration pneumonia. If aspirated into the lungs, that means aspirated pneumonia, that means it is the infection into the lungs after the inhalation of food, liquid or vomit into the lungs. If it is inhaled into the lungs, it can cause aspiration pneumonia. Avoid the use of decongestant drops, because that can shrink the swollen membranes in the nose for a long time, or their frequent use or excessive use, because there becomes ineffective and may actually worsen the patient nasal congestion. Be careful to use two drugs with correct concentration. A patient nurse should be careful about the concentration of the medication. Identify the drug correctly. Follow the rules for the administration of medication towards the patient. Now we are heading about the procedure. What are the steps and its purposes? First, nurse should be ensures about the correct patient. Ensures that correct patient receives the medication. Nurse should ensures the correct patient. Secondly, determine which sinus is affected, and which determines the patient position during drug. Nurse should be known about the which sinus is affected. Otherwise, medication will be go to the wrong sinuses. Determine whether patient has any non-allergies to nasal instillation. Otherwise, it may prevent any infection, or it may prevent any. It can confirm any complication. To prevent the complication, patients should be determined with the allergies. Perform hand hygiene to prevent the infection. Explain the procedure and position to the patient. It helps to acquire the comfortable administration of medication. Arrange the supplies and medication at bedside. It helps to administer the medication comfortably or carefully. Ensures the smooth or orderly procedure. Apply the gloves if patient has nasal drainage. It helps to transfer the microorganism. Instruct the patient to clear or blow nose gently. Nurse should instruct the patient to clear or blow the nose gently before administering the medication. Otherwise, medication will thrown out with the discharge of the nose. Removes mucus secretion that can block. Administer nasal drop. Then nurse should assist the patient to supine position. That position provides assist to the nasal passages. Then position the head properly. Position allows the medication to drain into the affected sinuses. For access to posterior pharynx, tilt patient head backward. Nurse should access patient to tilt the head backward. It will helps to it will helps to medication for the new. It will helps to provide the medication will enter into the correct sinuses. For access to ethmoid or sphenoid sinuses, tilt head back over edges of bed or place small pillow under the patient's shoulder. Support patient's head with non-dominant hand. Don't use dominant hand. You should use non-dominant hand so that there will not be transmission of the infection. Instruct patient to breathe through mouth. Patients should not be allowed to breathe through now nose. Hold dropper 1 centimeter half inch above ears and instill a prescribed number of drops allowed midline of the ethmoid bone. Medication should be prescribed according to the prescribed number of drops towards the midline of ethmoid bone. Instilling towards the ethmoid bone distributes the medication over the nasal mucosa. It will help to distribute the medication all over the nasal mucosa. Offer facial tissue to blood running nose, but caution patient against blowing nose for several minutes. Don't allow patient to blow the nose after administering the medication, otherwise medication will be thrown out with the nose drainage. Prevents premature loss of medication through ears. Allow maximum amount of medication to be absorbed. Assist patient to be comfortable position and dispose head supply. Offer facial tissue. Assist patient to a comfortable position and dispose of soiled supplies in proper container. Restore comfort, maintain neat orderly environment. Observe patient for onset of side effect 15 to 30 minutes after administration. Drugs absorbed through mucosa can cause systematic reaction. Patient should observe the patient for onset of side effect 15 to 30 minutes after administration, whether it is harmful or not. Nurse should observe the patient after the administration. Ask if patient is able to breathe through nose. It may be necessary to have patient occlude one nostril at a time and breathe deeply. Patients will be allowed to breathe through a nose. It may be necessary to have patient occlude one nostril. It will help to determine the effectiveness of the decongestant medication. Now then, we are heading towards the last most heading, that is throat irrigation and gargles. Definition: a throat irrigation is a washing of the throat oropharynx with a stream of solution. Acute or chronic throat inflammation are often treated by periodic bathing of a throat with warm physiologic, saline, or by any mild antiseptic solutions. Throat irrigation are more effective than garglings. Then, garglings means the act of bubbling liquid in the mouth. It is also the washing of one's throat with liquid. Gargling with salt water is not recommended. Often write gargles. As we know that gargling with salt water is not recommended. Often diet gargles can cure the sore throat, but using the wrong can make a worse stain. So it is not recommended with the salt water for gargling. Now we are heading towards the purposes. First is to treat the inflammation by the application of it. That means tonsils, which is it is a pair of soft tissue located near the pharynx. To provide the antiseptic effect, these medications are used to provide the antiseptic effect to relieve the congestion, swelling, and pain. It helps to relieve the swelling towards the throat area, that means tonsillitis, to soften the mucus and to prevent the accumulated secretion from the throat. Now we are discussing about the procedure. Firstly, nurse should explain the procedure to the patient to make the administration of medication easy. Make the patient sit on a chair with back support so that he can lean backward with the head tilted backward. It will the head tilted lean backward and head tilted backward, which helps to administer the medication easy. Adjust the spotlight behind the patient so that it will easy. Yeah, it will help to do the procedure comfortably. So the reflection from the head mirror can be directed to the throat. Hang the irrigator not more than 18 to 24 inches above the level of the mouth. Irrigator should not be hung not more than 18 to 24 inches above the level of the mouth. Otherwise, damages or infection may occur over the throat. Solutions are used as hot as the patient can tolerate, and it should never be over 49 degrees Celsius, that is 120 degree Fahrenheit. Solutions should not be hot as the patient can tolerate. There should be the confirmation of the patient that the hot or moderate warm medications can be used for the treatment of the throat. The patient can take the irrigation with adequate explanation. The patient open the mouth and insert the nozzle without touching the base of the tongue or uvula. The nurse should explain the procedure that to the patient that insert the nozzle without touching the base of the tongue or uvula. Then the patient should be told to direct the solution to all parts of the throat so that it reaches to every part of the throat. The patient should direct the medication to all part of the throat so that it can reach all all part that is inflamed. Otherwise, so that it can reach to every part of the throat. While irrigating the throat, the patient should hold the breath to prevent aspiration of the fluid. Periodically, the flow should be stopped to enable the patient take breath. While irrigating the throat, hold the breath to prevent aspiration. The patient should hold the breath to prevent the aspiration of the fluid. In gargling, the fluid does not reach all part of the throat, therefore it is not as effective as the irrigation. Also, gargling is not uncomfortable for the patient. So, the throat irrigation is more effective than gargling. Thank you.